Dr. Redcross.
Hi, Dr. Redcross. This is Sarah from KNLB Christian
Oh,
Radio.
hey, Sarah. How are you?
Hi, good. How are you doing?
Good afternoon.
Hi, Debbie.
Yes, good to hear from you
Hi,
again,
how are
right?
you?
Good, doing well.
Good. I'm so happy to catch up with you guys.
Yes. Well, we're so thankful to have you, Dr. Redcross. And today you are going to be speaking with us and our audience about gut health. Now, I know I've heard it said that the gut is known as the second brain, and it really impacts all areas of a person's health. And when it's compromised, immunity, stress response, sleep, mood, hormones, they all take a hit. And so today you're going to share with us having the right synergy between both pre and probiotics can provide health advantages, especially during allergy season.
Absolutely. Well, look, thank you so much for having me on. This is such a beautiful topic now because even within healthcare, we always thought of this one brain, but now we're recognizing that you're right, that the gut is actually a second brain that can do some important things. And with us dealing with this pandemic, it's important to understand the big role that the gut can also play with immunity, right? And so it's important to have this topic. So thank you for having me on. Let's talk about it today.
Dr. Redcross, so first, tell us about how that works. I mean, what does that mean by a second brain?
Well, I mentioned it that way because think about it, everyone. So about 60 to 70, and sometimes even 80%, depends on what studies you read, our immune cells are housed in the gut. So therefore, it becomes even more important the sort of things that we're putting in our gut. We should be putting more of some things that we'll probably talk about today and less of others, but also making sure that you have that perfect balance of probiotics or prebiotics to get that balance that's necessary to make sure that our microbiome is really ready to go when we get these insults introduced into our body.
Prebiotics. I hadn't heard of that term before, but I've heard of probiotics.
Let me explain that, Debbie. So I'm glad you brought that up because it is somewhat newer because we've all been hearing about probiotics for years now. Prebiotics are almost like fertilizer for the probiotics. So why does that matter? It matters because when you get that sort of fertilizer, that causes that probiotic to have food and propagate or proliferate even more. So in other words, it's almost like a way to boost your probiotic in a sense to have a prebiotic. But not everyone out there understands the prebiotic, and a lot of the probiotics out there don't have both of them. So you have to really make sure you pinpoint some of the better ones on the market that have both.
Now, I've heard that leeks have a good source of prebiotics. Do you know of any other foods where we can have those good prebiotics?
Sure. So think about it this way. So one of the ones I always talk about is because it's so ubiquitous. We always have them in the house, it seems, and that's bananas. Bananas have a fiber called inulin, and the key there is that particular fiber is not particularly well digested by us, but it is well digested by the bacteria in our gut, so therefore a wonderful prebiotic. Also, you mentioned leeks. Other greens with that are spinach, the collard greens. Those sorts of things, once again, act as great prebiotics in this case, and also sauerkraut, or I like kimchi, whichever is a fermented food. And so those are some of the things that we should have on in our cabinets to make sure that we're getting the good prebiotics that our bodies really need and crave to stay healthy and well.
Now, I see kombucha is on the list, and I typically have that at home, drink that every once in a while. So glad to know.
Good for you.
And yogurt is always in the fridge as well.
That's right. You're halfway there.
Also, green tea. Talk about the polyphenols in green tea.
So, it's funny. Even though I'm in the medical field, guys, I'm the only one of the only docs who does not drink coffee, but I drink tons of green tea. The reason why is because you get the polyphenols. And the polyphenols, everyone, are like almost antioxidants. Once again, they help to keep the good bacteria healthy. And there's even been studies that show that it can actually affect some of the bad bacteria, which is what we want because we don't want that bad bacteria able to kind of grow within our GI tract, of course. So something like green tea can make a really big difference if you can just kind of add that into your pantry as well.
I like it.
Does your green tea have caffeine in it?
No, not for me. If you guys can't tell, I have more than enough energy. The last thing I need in my home with a set of twins, well, maybe I do need that caffeine, actually. Maybe I do, now that I think about it. But no, typically I don't. I don't do too much caffeine.
Well, what about the foods that we may want to avoid that could affect our gut health?
Now, look, here's the good part. So we talked about some things that we can have in our pantry that make a difference on the good side. Now, on the bad side, look, some of these just make sense. Red meat. We know our GI tract does not do particularly well with red meat, but if you are a red meat lover, I just ask my patients, go with the leaner cuts. Red meat in and of itself can cause some inflammation, can cause the development of some metabolites that don't do well with our gut bacteria. The other thing is that I write here to myself, fried chicken, fried fish, anything fried is not good. It's not necessarily just the batter. It's also the fact that the oil that these things are cooked in are also detrimental to the bacteria that's there. The other one, alcohol, we all recognize too much alcohol is never a good thing, obviously for the liver and so forth, but there's actually studies that show that too much alcohol can also kill off that good bacteria. And last but not least, one of these is a little bit tougher for us, right? Because we're thinking of foods that have antibiotics in them. You guys can't see, I'm holding up a big X. That's a no-no.
Mm-hmm.
I don't want you taking food that has antibiotics because that also destroys the gut microbiome. The other thing is when you go to your doctor's office. Now, I'm a Western-trained physician, everyone, but I'm on the eastern side of healing, so I try not to use my prescription pad, but sometimes antibiotics are, in fact, needed. So if you do need an antibiotic, I just want to make sure you have a discussion with your doctor to make sure that you're adding a probiotic after the course of antibiotics. So once again, get that good bacteria back where it belongs.
Now, I know a lot of our farm-raised chickens and cows and all of that are given antibiotics to kind of protect them from some of the diseases and things that they'll get. Unfortunately, it's this vicious cycle of, even our meat, we don't even realize, but it's packed with antibiotics.
Does that mean we need to buy organic?
Exactly. To try to buy organic, I will say that they've also been putting it on the packaging sometimes, just to be honest and transparent, to say that, and it's tough because I have some friends that are farmers out by you guys way a bit. And so it's a discussion back and forth. I get it. They're doing it to keep these animals healthy in order to be able to get to our dinner table as well. But we just have to be careful and at least be transparent so that we can say, okay, I know I need to kind of supplement my microbiome because it's being affected, whether you're in my office with your doctor, everyone, or whether it's some food that's coming. But, you want to try to buy organic if possible.
Now, Dr. Redcross, really appreciate this topic on gut health, and it's so important. I know there's times when I will eat horribly, and it affects me the next several days, and then I get it back together and eat healthy again. But can you just share with us maybe some other holistic approaches that can help boost our gut health?
Yeah, and so let me tell you, one of the things, and like I told you guys, I'm a little bit more on the natural side of healing. So we talked about some good foods, and we talked about some foods to avoid. But even with the good foods, it's a big challenge to kind of get enough probiotics. I talk to patients because there's so many dizzying options out there. They always say, Dr. Redcross, which probiotic, which one to get? So I like one called Pro Plus Thin Biotic. And the reason why I talk about Pro Plus Thin Biotic in particular, it goes back to your question, Debbie. It has a prebiotic and also a probiotic all in one place. So it's easier for my patients to have it there. I also love the fact that I'm a big studies guy, and it has a study with 3 bacteria. It's kind of cute. They call it the Friendly Trio. And this Friendly Trio was shown in studies to do big things, not only for just immunity and digestion, but it also helped with allergy. It helped ease allergy symptoms for what it did with T regulator cells that are there. So when you get that benefit in particular, and it's also easy and that it's chewable and shelf-stable, those things are important when you're looking for a probiotic. So I just happen to talk about Pro Plus Thin Biotic, and I know that there's others out there, but check to make sure that they're shelf-stable. And the reason why I mention that, everyone, is sometimes the probiotics that are on the counter, they're there, but the microorganisms in there are not live. So you're pretty much not getting the big benefit. So you want to do your due diligence. The other thing, exercise and sleep, ginormous, especially exercise. Tons of wonderful studies about exercise and the microbiome. In fact, it's funny. I took my probiotic this morning, and right before talking to you guys, I just took my bike ride this morning, 17 miles. So I feel that my microbiome is the second thing. Plenty of sleep, and sleep is important. 7.5 hours each and every day. So once again, support that microbiome.
And that 17-mile bike ride will give you plenty of good sleep tonight.
Absolutely. Like I said, it's a beautiful thing. It's like a double, a double shot there. I don't know about you guys, but most of my patients want simple. And so it was nice. It was nice. I used to talk about them separately, but now I don't really have to. And then, like I said, I'm a big studies person. And when you look at there's lactobacillus and bifidobacterium, those are long words. Just remember the friendly trio. That's what I tell patients.
Friendly trio.
That's so easy. That's so easy to remember.
Okay.
Hey, I've got a question for you. I know that
Please.
I eat my probiotic plain yogurt every afternoon, probably maybe a quarter cup at least. And
Nice.
but I know that dairy is not so good for you, your arteries. And
Yep.
what do you think about that?
Yeah, and you look, and it's funny. Just like I told you, I have my buddies who are farmers, and on the farm side, I have some dairy friends too. And just to be quite honest, the issue with dairy, and I don't do dairy, I don't do milk and creams and that sort of things either. And for me, it's about that inflammation that we get. Look, when we think about inflammation, everyone, inflammation causes dis-ease, right? The inflammation, our body just doesn't do well with it. And so for some of them who like their milk products, I always say moderation. But yeah, I try to dial back on dairy. And I think that's the reason why we're seeing so much lactose deficiency, because our bodies really weren't made to digest cow's milk, to be quite honest. So you have to be careful with it. And for those who love it, I don't discourage it too much. I just say let's just dial it back a bit.
Very good. Hey, where can we get more information about what you've talked about today?
Sure. So look, reach out, say hello, and I really mean this. For anyone who has any questions, my website is drkenredcross.com, but you can send me questions or whatever you like to. You can also go to probiotics.com. As I mentioned, I am an advisor for probiotics, so we can talk anything probiotics, whether it's Pro Plus Symbiotic or whatever. Let's just have the discussion.
Thank you, Dr. Redcross. We really appreciate your time today and your wonderful wealth of knowledge. I know I've taken away quite a bit and really encouraged to just take care of my gut and start feeling just optimal. Thank you.
Thank you both. Have a beautiful and blessed day, everyone.
You too.